Blessed Sunday, everyone! Welcome to Doctors on TV. Isang mahalagang topic ang ating pag-uusapan ngayong umaga, lalo na't may kaugnay nito sa ating mga puso. But before going further, we would like to invite you mga kasambahay, don't forget to follow and subscribe on our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type youtube.com/@doctorsontv. And you can actually send us questions and comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends. Bago po tayo dumako sa ating kaabang-abang na topic, atin pong alamin kung gaano nga po ba ang death cases ng cardiovascular diseases. Let's watch this.
Did you know that cardiovascular diseases or diseases of the heart and blood vessels are responsible for 1/3 of death in the Philippines? According to the 2021 report of Philippine Statistics Office or PSA, 72% of recorded death in the Philippines is due to cardiovascular diseases, a kind of non-communicable disease. When the COVID-19 pandemic started, it threatened the health and lives of people with cardiovascular diseases, making them more at risk of severe illness or death. In this case, the Department of Health, World Health Organization resolved to save lives, and World Heart Federation commit to strengthen collaboration for action needed to prevent deaths caused by cardiovascular diseases.
Nakita po natin, nakakapangamba talaga ang ganitong klase ng sakit. Mga datos pa lang yan sa Pilipinas po ha. Paano pa kaya worldwide data? Kaya mga kasambahay, naku, ingat-ingat po tayo. But before we move to our topic, we will be right back after this break.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 Home Kit: thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Life Saver dito sa UNTV, your public service channel.
Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ang impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Ang paggawa ng mga kantang papuri para sa ating Panginoon ay pagpapakita ng ating pagmamahal sa Kanya. Manood po kayo ng A Song of Praise Music Festival every Sunday, 7 p.m. here on UNTV.
Different medicines are invented to take care of our heart, but still, laughter is the best medicine. Why? A good laugh causes the tissue of our blood vessels to expand. It could increase blood flow by 20% throughout the body. Stress, on the other hand, constricts our blood vessels and reduces blood flow. Laughter makes our heart's job easier. Try to laugh more often. For more healthcare tips, watch UNTV, your public service channel.
Welcome back to Doctors on TV. And now mga kasangbahay, before we move forward to our topic, we would like to share with you how to strengthen our immune system with a nutrient-dense diet. Let's watch Naturally Yours.
Good morning mga kasangbahay. It's another Sunday full of information on how to keep us healthy naturally. Sa pamamagitan ng isang maliit na aparato na kung tawagin ay blood pressure monitor, malaking bagay na ito upang mabantayan ang ating blood sugar. Pero nakakalungkot isipin na hindi bahagi ng pamumuhay ng maraming Pilipino ang pag-monitor sa kanilang mga blood pressure. Tara, pag-usapan natin paano nga ba natin maiiwasan ang hypertension in a natural way. Para makaiwas tayo, lagi tayong mag-ehersisyo araw-araw. Isang oras na paglalakad, jogging, cycling, swimming o pagsasayaw ay malaking naitutulong para maiwasan ang pagkakaroon ng hypertension dahil pinapalakas nito ang ating resistensya. Umiwas na din tayo sa pagkain ng masyadong maaalat dahil hindi po ito maganda sa ating katawan. Umiwas na rin po sa pag-inom ng alak at paninigarilyo. Monitor your blood pressure at home at lagi po tayong magpapacheck up kapag may hindi magandang nararamdaman. Bukod dito, huwag nating kalimutan ang ating immune system dahil ito ang natural defense ng ating katawan at ang pagkakaroon ng nutrient-dense diet ay malaki ang maitutulong sa atin para palakasin ang ating immune system. Katulad ng mga pagkain na merong mataas ang anti-inflammatory, katulad ng garlic. Limitahan din po ang ating pagkain ng asin or maalat. Bantayan po natin ang mga pagkain lalo na ang mataas na potassium. Umiwas po tayo sa pagkain or inumin lalo na ang merong caffeine at ang mga alcohol. Napakasimple lang, di ba mga kasangbahay, at madaling tandaan. Kaya naman sundin lang natin ang mga ito. For sure, maiiwasan natin ang pagkakaroon ng hypertension. Muli, ako po si Dr. Jason Sanchez, your integrative medicine doctor. See you again next week for another dose of natural ways to be healthy because natural is beautiful. Only here at Naturally Yours.
Thank you, Dr. Jason Sanchez, our integrative medicine doctor, for sharing some tips for our viewers. And for today's topic, makakasama po natin si Dr. Rosario Soledad Neri, a Cardiology Specialist from Makati Medical Center and current Council Chair on Cardiomyopathy and Pulmonale of the Philippine Heart Association. Hi, Doc Cha! Welcome to Doctors on TV.
Good morning, Dr. Sarah, and good morning to our kasambahays, the viewers of Doctors on TV. Thank you for having me here today.
Yes, and thank you at pinaunlakan nyo kami, Doc Cha. And you know, napakaraming, di ba, na mga matataas ang BP, mga hypertensive patients natin. And we know that one of the complications would be having a hypertensive heart disease. So, napakarami pong magbe-benefit sa atin pong episode for today. But before we move to our discussion, let us know what is hypertensive heart disease. Let us watch this.
Hypertensive heart disease occurs when your high blood pressure is neglected for a long time. It is a strain added on your heart that can lead to heart failure or other health problems. It is important to treat high blood pressure because if left untreated, it may cause long-term conditions that develop over many years in people who have high blood pressure.
Okay, so Doc Cha, can you explain more, Doc, what is hypertensive heart disease?
So, ang hypertensive heart disease is a term we generally apply to cardiac conditions caused about by prolonged, uncontrolled hypertension.
Okay, Doc, himayin natin ha, para sa ating mga viewers. So, pag uncontrolled ang hypertension or pag mataas ang BP for long, yung hindi ho nako-control, okay, so basically nagkakaroon ng epekto na hindi maganda sa puso. Tama po?
So imagine simply saying, no, when I tell my patients what hypertension is and what are the effects on the heart, I explain to them, imagine your heart is a muscle, no, and that hypertension is perceived as stress to the heart. So ang heart po, when you have high blood pressure, your heart has to pump extra hard or extra effort to overcome that high pressure. So imagine yung stress po na yon. It's like ang muscle pag ini-exercise, lumalaki po, di ba? So ganun din ang heart as a muscle. When it adapts to stress, pwede rin po siyang lumaki, pwedeng kumapal ang heart muscle.
Okay, so having said that, siguro pwede rin nating i-educate ang ating mga viewers. Bakit hindi natin gusto na lumalaki ang puso? Kasi di ba, usually alam natin yan ang heart, okay, sa isa siyang, you mentioned muscle, pero sa loob may space yan. Meron niyang 4 chambers or 4 na kwarto sa loob. What happens pag lumalaki ang puso?
So kapag lumalaki ang heart, no, when the heart muscle thickens, nagbabago ang structure ng heart. It can also affect the coronary arteries, yung blood supply po ng puso. No, it can also affect the electrical conduction inside the heart. And therefore, pag nagkakaroon ka ng mga ganitong cardiac dysfunctions, it can lead to left ventricular hypertrophy, heart failure, coronary artery disease, and cardiac arrhythmias.
Oh, okay. So basically, nakita natin, tuloy-tuloy nag-i-increase ang severity, mas dumadami ang komplikasyon, okay? Mas nagiging marami yung condition na hindi maganda ng heart, okay? Tama, okay. And usually po, di ba, sinabi na natin kanina na it's hypertensive heart disease. But of course, for the benefit of our viewers, ano talaga yung main cause ng itong condition na to, Doc?
So from the term itself, ang hypertensive heart disease, it's actually a long-term condition. Again, the main cause is uncontrolled high blood pressure. Matagal po nating napabayaan for years or even decades. And therefore, it can eventually affect the heart function.
I see. And sino po yung mga at risk, okay, magkaroon ng ganitong condition?
Just like in hypertension, you have modifiable risk factors and mga non-modifiable risk factors. So when you say modifiable risk factors, these are things that you can still do something about. You can correct, you can reverse, no? Number 1, unhealthy lifestyle. The diet po.
Naku, maraming guilty dyan,
Yes.
Doktora. Okay.
High salt diet, fatty diet, yan po, no? A sedentary lifestyle, lack of exercise, no? So those are things that we can modify. Others, elevated blood sugar, elevated cholesterol levels, smoking, excessive alcohol drinking. So those are things that we can still work on. While for the non-modifiable risk factors, ito po yung innate na. No, you're born with it. And it's number 1 is age. Advancing age is a risk factor. Your gender, your sex, no? Usually it's the male, mas common sa male population.
And bakit nga ba ang male? Kasi syempre, parang kawawa naman ng male, lagi na lang sila, di ba?
Yes.
So bakit, what is it in males that make them more predisposed to, to these, to hypertension and its complications?
Well, studies have shown a lot of possible causes, pwedeng behavioral, social, and genetics po, no? So, syempre, ang male, they have the tendency to, when they release stress, they drink, they have this unhealthy lifestyle, so that can predispose them to hypertensive cardiovascular disease. Another is the way to relieve stress. Tayo mga babae, we talk to our friends, we find ways to relieve stress. But for men, they tend to keep to themselves, they isolate, no? So, kumbaga, all that stress can build up, And then, for women kasi, up until a certain age, we have this neuroprotective hormones na tinatawag that can help prevent cardiovascular disease. But after menopause, then pwede na mag-set in yung mga risk natin for cardiovascular
That's why kapag ka
disease.
pumasok na sa menopausal stage, okay, that's when saka pa lang magsiset in. I mean, usually sa mga
that's
babae,
when you see it.
Okay, and then, so apart from the gender and, if it runs in the family as well,
Exactly,
ano pa yung
family
mga
history.
non-modifiable risk factors?
As you mentioned, Doktora, family history of hypertension, that's something you can't modify. So, at least when you're aware that you have a family history, di ba, you're more cautious, mas mag-iingat po tayo.
Okay, so yan, no? So basically, yun mga kasambahay, nako, kaya dapat ingat-ingat, no? And ito, Doktora, no? Okay, so usually po, sinabi nyo kanina na usually prolonged na uncontrolled yung hypertension before somebody, gets diagnosed with hypertensive heart disease. And ganong katagal tong matagal na panahon na ito? I mean, in your practice, usually mga nakikita nyo sa clinic, kalimitan pa, bago mag-present ng mga, mag-manifest ng mga signs and symptoms.
So there's no really specific number, no? It can span like years, pwedeng 5 years, sometimes decades, no? Or even 10 years. The sad thing kasi about hypertension or hypertensive patients, majority of them asymptomatic. Wala pong warning, no warning signals, no symptoms. So it's later on in the disease that saka lang may naramdaman, saka lang po magkukonsulta.
Yeah,
No?
oo.
So ganun sa hypertension. That's why we actually call it a silent killer. No? So the only way to find out if you have hypertension is to go to your healthcare provider and have your blood pressure measured.
Okay, and it should happen talaga regularly or randomly at least magpakuha ka.
Yes.
Okay, so you get to have an idea of ano ba talaga yung blood pressure mo.
Actually,
Okay.
the advice, doctor, is by 18 years old, no? You can have your BP checked at least every 1 or 2 years, no? Just to be sure that your blood pressure is controlled.
Yeah, and of course, especially after nagkaroon ng pandemic, well, we're still here, but I understand, di ba, lahat naman natin, alam natin na lahat nag-iba ang lifestyle, okay? Lahat kasi tayo medyo na-close tayo dito, na-enclose tayo sa ating mga shells, okay, for the past 2 years, okay? So, imagine, medyo ang nag-suffer dyan yung physical activity ng mga patients. Ako, doktora, umiinit yung ating talakayan, and of course, feeling nila guilty sila, no? But before we proceed, no, doktora, ito po, makasambahay na ko, wag muna po kayong bibitiw kasi marami pa tayong pinag-uusapan dito. Baka mamaya, isa sa pamilya po pala ay may ganito. Naku, sadly. Kaya kayo po please stay tuned dahil magbabalik po ang Doctors on TV.
Ito ang tama at maling paggamit ng bleach kung gagamitin na panglinis sa bahay. Ihalo ang 1/4 cup ng bleach sa 1 galon na tubig. Iwasan na paghaluin ng bleach at ang mga produkto na may ammonia tulad ng panglinis ng salamin dahil makagagawa ito ng nakalalason na chloramine. Huwag haluan ng alcohol ang bleach dahil nakalilikha ito ng chloroform na makasasama sa kalusugan kapag nalanghap. Huwag din paghaluin ng bleach at asido dahil nakalilikha ito ng chlorine gas na kapag nalanghap ay makasasama sa baga. Tandaan na mahalaga ang kalinisan at kaalaman para maiwasan ang sakit. A reminder from UNTV, your public service channel. Mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
I've been here for almost 3-4 years as a judge. And even as a judge, ako po ay talagang nabibless. Marami tayong mga Filipino composers that are so good. And buti na nabibigyan sila ng pagkakataon dito sa ASOC. No? To be able to have their songs sang, to have their songs listened by people. I continue to just encourage all the songwriters there, write with your heart. Write with your experiences. Continue to support a Song of Praise Music Festival every Sunday, aso po, dito sa UNTV, 7 p.m.
Welcome back to Doctors on TV, and we're still here with Dr. Rosario, Soledad, Neri, a Cardiology Specialist from Makati Medical Center. But before we continue, Doc, let's watch the diagnostic checkup of our patient. Let's watch this.
Isa si Ginoong Manuel C. Soriano Jr. ng San Jose del Monte, Bulacan sa mga nagkaroon ng severe COVID-19 noong kasagsagan ng pandemya. Bagay na nagpadagdag hirap sa katulad niyang matagal nang nakakaranas ng paninikip ng dibdib at hirap sa paghinga. Dahil dito, mas tumindi ang kanyang mga nararamdaman mula noong nakaraang taon. Kaya naman sa tulong ng ating partner doctors mula sa Makati Medical Center ay napasuri ang kanyang kondisyon.
At makakasama po natin ngayon ang naging pasyente ni Doc Neri na si Mr. Manuel Soriano Jr. or si Sir Manuel. Hi Sir Manuel, welcome to Doctors on TV.
Good morning po, Doktora. And good morning po sa lahat ng ating mga kasambahay na nanonood.
At ito po, Sir Manuel. Okay, so ito nga po, di ba pinag-uusapan namin kanina pa ni Doktora siya kanina, Doc siya about hypertensive heart disease. Okay, and medyo i-share po natin sa ating mga viewers ang inyong pong kaso, ang inyong case, if okay with you. Basically, ano po yung nag-prompt sa inyo na magpakonsulta, na lumapit po sa ating programa na Doctors on TV para po medyo maiayos na po natin yung ating kondisyon?
Kasi last week po, nakaramdam ako ng paninikip ng dibdib. Pero dati ko nang nararamdaman kasi yung minsan sumasakit talaga dibdib ko. Meron kasi kaming history sa family namin na may mga sakit sa puso. Ang uncle ko, namatay siya sa heart attack.
I see. Sorry to hear that.
And then sumunod yung father ko naman, ganun din namatay sa heart attack.
Okay. And sabi niyo po last week po kayo ay lumapit kayo sa ating programa, and of course nilink po ng Doctors on TV dito po sa Makati Medical Center, and of course Dr. Neri is assisting you po ano po yung nararamdaman niyo noon, o yan ba nararamdaman niyo na rin po dati? Okay, so ano po yung we would want to know po kung ano yung naging medical history niyo para maibahagi ho natin sa ating mga viewers.
Last Tuesday po, nung nag-usap kami nung kineka po ako ni Doktora, ang nararamdaman ko that time, nahihilo talaga ako. Tapos nung i-BP niya po ako, 160/100 po yung aking BP. Tapos nagpa-laboratory po kami.
So when I saw Mr. Soriano when he came into the clinic, so it's a 54-year-old male. Of course, the first thing we do when a patient comes to you with chest pain, syempre, we interview, we ask for his medical history. Tama po si Dr. Sara. Paano nagsimula ang pain? Ano pa po ang mga ibang simptomas ni Sir related to that chest pain? So in the course of the interview, I found out may mga nararamdaman si Sir like that dizziness, chest discomfort, shortness of breath, and then as we go through, nasabi nga ni Sir ang kanyang strong family history for heart disease. However, si Sir mabait, non-smoker, non-alcoholic beverage drinker, so mabait naman sa lifestyle si Sir. And then, of course, after the history, you proceed with your physical examination, and dun nga po, una kong kinuha is the blood pressure. And then, I even took it twice. Ang blood pressure po na nakuha natin ay 160/100. Yes, it was really high. And then, upon probing, apparently po, may history na pala na tumataas ang blood pressure ni Sir. When he had COVID, severe COVID po yun, in 2021, around October
September
or
3
November.
po.
September,
2021,
okay.
nung ako po ay na-COVID.
Okay, and after that time po na nag-COVID, and praise God, of course, nalagpasan niyo po ang COVID, especially na-mention niyo po na severe ang naging kaso niyo ng COVID noon, nagkaroon po ba ng discussion, or nagkaroon po ba ng management with regards po dun sa inyong hypertension? May iniinom ba kayong maintenance? And nakabalik ba kayo sa inyong doktor?
That time kasi nung na-COVID po ako, sa bahay lang ako. Yung sa kapatiran po namin, sa church namin, nagdala po sila ng oxygen. And then, sa amin kasi, sa atin kasi sa church, meron tayo online clinic.
Opo.
So, tinawagan ako ng mga doctors. Tapos, tinuruan ako ng proper breathing. Tapos, nag-prescribe sila ng mga gamot. Tapos, nalaman ko na lang, dumating na yung mga gamot. Binigay na rin sa akin mga kapatid yung gamot. Pero yung that time kasi, nahirapan ako huminga. Tinakbo na rin ako ng barangay para ipa-x-ray kasi ginaday ko yung pag umubo ako, masakit yung buong likod ko. Nalaman nila na severe nga kasi bilateral na yung sa baga ko pa yun ng merong nakikita sila.
Pneumonia.
Pneumonia. Tapos, yung awat tulong ng Diyos, gumaling naman ako. Pero, gumaling ako na nawala na yung mga sakit na naramdaman ko, wala na yung lagnat, wala na yung bumalik na paglasa ko. Pero yung paulit-ulit na katulad dito, inuubo, tapos sumasakit yung dibdib, continuous pa rin yun.
Okay po.
On and off. May mga time na nawawala siya. After some time, mararamdaman ko na naman siya. Kaya sabi ko, ay siguro kailangan ko
Kailangan niyo na. Opo. But yung kanina pong tanong ko na after po ng inyong COVID infection, hindi na po nagkaroon na nakabalik kayo right away sa isang doktor para ma-manage po yung hypertension nyo?
Hindi na po.
Okay.
Hindi na po.
But of course, at least it's good na nakapunta dito nga kay Dr. Neri. Okay. And Doktora, so napagawa niyo yung mga ibang laboratories, yun pong mga naging results po ng kanyang mga diagnostics.
Okay. So, in a patient na ine-evaluate po natin, no, na mataas ang blood pressure, we do work up. Well, yung kay sir, when he came into the clinic, dala niya na yung kanyang mga blood test. So, kasama po doon ang CBC, then yung blood chemistry. Blood chemistry, ang included there is the fasting blood sugar to screen for diabetes. Yung kay sir, nandun po tayo sa pre-diabetic range, no?
So, pre-diabetic
pre-diabetic na si sir. And then we looked at the lipid profile. This is to check all the cholesterol in the blood. And nakita nga po natin that the bad cholesterol is high, no? So may dyslipidemia na rin po tayo. Okay, but however, at least the kidney function, liver function remained okay. So, despite the prolonged hypertension, nagpagawa din po si sir ng urinalysis and so far normal naman ang result, and even the chest x-ray had no significant findings. So with that, additional test that I requested for as a cardiologist, baseline, a 12-lead ECG or electrocardiogram po, and of course, a 2D echocardiogram.
Okay, and kamusta naman po yung mga resulta,
Okay.
Doktor?
Well, the ECG, normal naman po ang heart rate ni sir, no? I did not see any signs of injury or heart attack based on the ECG. However, sa 2D echo po, doon na natin nakita yung minention ko po kanina na pwedeng chronic effect of a uncontrolled blood pressure, and that is, meron na po siyang tinatawag na concentric left ventricular hypertrophy.
So, lumalaki po yung left ventricle
Kumakapal
niya.
na po yung walls of the left ventricle due to that chronic stress from the hypertension.
Okay, nako, medyo tumitindi itong usapan natin. No? And of course, marami nakaka-relate, I'm sure. No? But before we proceed, okay, so siguro let's pause for a short break muna. Kaya nako mga kasambahay, wag po kayong bibitiw dahil magbabalik po ang Doctors on TV.
Tama at maling paggamit ng alcohol bilang disinfectant. Karaniwang ginagamit na disinfectant ang alcohol kung hindi agad makapaghuhugas ng kamay. Inirekomenda ng DOH ang paggamit ng 70% alcohol. Hindi inirekomenda ang mas mataas na percentage dahil kailangan ang sapat na dami ng tubig para makapatay ng mikrobyo. Ang methanol at ibang uri ng alcohol na ginagamit sa industriya ay hindi rin inirekomenda dahil makasasama ito sa kalusugan. Ang alak o alcohol beverages naman ay hindi epektibo bilang disinfectant dahil 40% lang ang taglay nito. Huwag haluan ng bleach ang alcohol dahil nakakalikha ito ng kemikal na kapag nalanghap ay makasasama sa kalusugan. A reminder from UNTV, your public service channel. na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Tinulungan ng UNTV News and Rescue Team ang isang 62 anyos na Amerikano na nahulog sa higaan sa Butuan City. Nagtamo ng posibleng bali sa balakang ang matanda. Matapos malapatan ng first aid ay agad na dinala ang biktima sa ospital.
Kapag ang pasyente ay nahulog at nagtamo ng bali sa katawan, obserbahan ng pasyente at i-assess. Pwede po nating sabihin sa pasyente na galawin ang kanyang mga kamay at ang kanyang mga paa para malaman po natin kung may damage sa kanyang spinal cord. Para maiwasan po ang further damage or injury ng pasyente, huwag po natin itong gagalawin. Hayaan po natin sa posisyong natagpuan natin at tumawag po tayo ng ambulansya at dalhin sa pinakamalapit na ospital.
Ito ang serbisyong hatid ng UNTV News and Rescue.
When we take off, you get a fresh overview of the news. From city issues to countryside stories, we tell you about celebrations and accounts of destruction. With drones, we give you not just visual narratives from a whole new perspective, but service on a higher altitude. This is our advocacy at UNTV Drone Journalism.
Watching Doctors on TV. And ngayon naman po ay pag-uusapan po natin kung paano ba dapat ang treatment para sa ating pasyente. That Dr. Rosario Soledad Neri, a Cardiology Specialist for Makati Medical Center, will explain to us. So ito no, Doc, kanina napag-usapan natin, di ba, Sir Manuel, yung mga yung medical history, okay, yung result, yung sa physical examination, yun din, Doktora. Napag-usapan na rin natin na ibahagi natin sa ating mga viewers din yung mga resulta po ng kanyang mga laboratory examinations, and of course, yung 2D echo din and yung 12-lead ECG. Okay, so ngayon naman po, Doktora, ano yung pinaka-treatment plan for Sir Manuel?
Okay, so number one, syempre nakita po natin, the blood pressure is really high. So our number one step, adequately control the blood pressure. And always for all my patients, whether it's hypertension or any other cardiovascular disease, our number one or cornerstone of management is lifestyle modification. So yun po ay advisor has to be a healthy diet. We actually recommend the DASH diet. So the DASH stands for Dietary Approaches to Stop Hypertension. So pagka ganun pong diet, ang diet na yun, it's rich in fruits, vegetables, fiber, whole grain, fish, no? Dapat po low-fat dairy, iwas na po tayo sa high salt intake, cholesterol, fatty foods, and processed meat, no? Yun po. So that's one, healthy diet. The other is exercise, sir, kung kaya po, no? So as cardiologists, we usually recommend moderate aerobic exercise, at least 30 minutes a day, 5 times a week, no? Makatotal po kayo ng 150 minutes of aerobic exercise in a week. So, pwede nyo pong hatiin yon, divided into how many days. Now, aside from that, if your patient is a smoker, of course, you advise to stop smoking. If alcoholic beverage drinker naman po, no, you always advise also to limit or syempre, any alcohol intake should be in moderation.
Kung kayang i-cut off totally, that's a lot better, di ba?
Yes. And for women, it's different. Tayo mas mababa ang threshold. It's just 1 drink a day. So, ganun mga lifestyle modification. Now, if despite that, no, despite those healthy diet, exercise, the blood pressure really remains elevated, then we have to help mala po with medications, no?
Okay.
So with sir, when he came in with the 160/100 na blood pressure, I had to start him na on a medication po.
Okay, so basically, pag tinignan mo, this really is a team effort between the doctor and the patient. So, actually, paglabas ng clinic ng pasyente na may ganitong condition, talagang, Sir Manuel, kayo na talaga ang bahala sa health nyo. Basically, just have to be compliant, susundin natin yung mga payo sa inyo ni Doktora. And, Doktora, how often siya dapat nagvi-visit sa inyo? Okay, yung mga katulad ni Sir Manuel na diagnosed po of hypertensive heart disease, how often po or how close yung interval of the cardiologist visit?
Okay, so for me, no, what I do with my patients, especially if it's the first time I'm putting them on a medication, I usually give them good for kahit 2 weeks muna because I want to see and observe their response to the medication. Kasi po, kung kunyari, kulang pa, not adequate, then we can easily adjust and find the right dose of medication para sa ating pasyente. Kasi nga, again, our main goal is to control the blood pressure so that first 2 weeks. And then if your blood pressure control is achieved in the next 3 months, that's your goal po, no? You can see the patient like every 3 or 6 months, no? And then do the tests again, just to be sure na all the other risk factors are well controlled as well.
And of course, for the dose adjustment of the medications, Doktora, no? So, I know we have been reiterating na ang culprit dito would be hypertension para magkaroon ng hypertensive heart disease. But, by any chance, is there a way to avoid pa rin ito, Doktora?
Hypertension is actually preventable and treatable, no? Number 1, again, really, it's lifestyle. No? So, if you keep a healthy lifestyle, that's a good diet, you exercise, physical activity, avoid yung sedentary, then yes, you can still prevent hypertension to set in and eventually cause the cardiovascular disease.
I see. Okay, so narinig natin, ang ganda ng mga advice ni Doktora. Okay, kamusta naman dyan, sir? Kaya ba? Kaya?
Kaya mo siguro po mag-exercise, saka kumain ng mga healthy diet po siguro.
Babantayan natin kayo, ha? Kailangan pala may follow-up na guesting dito, Sir Manuel. Okay, I'm just kidding. So, do you have any message po sa ating mga viewers? Okay, and of course, Dr. Neri and the Makati Medical Center, we're all helping you out po para at least, di ba, ma-achieve po natin yung goal, ma-help po kayo with regards to your health.
Siguro mapapayo ko lang sa mga nakikinig at nanonood na mga kasambahay natin, yung pag-aalaga sa sarili. Yung kung may nararamdaman tayo, dapat talaga humano tayo ng magpakonsulta tayo sa doktor kagad. Kasi minsan natatakot din, katulad ko sa case ko, parang kaya ayaw ko magpa-check up kasi parang ayaw ko malaman sakit ko eh. Baka kasi, minsan kasi pag may nararamdaman ako, parang naisip ko na lang, ipanalangin ko na lang. Pero mali pala yun, naisip ko siguro talaga dapat noon pa. After nung na-COVID ako, dapat nagpa-check up na kagad ako.
Di ba, it's never too late. Ito naman, nandito naman na kayo. And of course, to continue.
Po, nagpapasalamat ako sa Diyos, nagpapasalamat ako sa inyo, Doktora. Sa inyo rin po, Doktora, nagpapasalamat ako. At sana po mga nanonood pong mga kasambahay po natin, alagaan po natin ang ating mga sarili. Higit sa lahat, Siyempre, manalig tayo sa Diyos, magtiwala at manalangin tayo palagi.
Yes, and of course, sa Doctors on TV po and sa UNTV. Okay, and thank you very much again, Sir Manuel. And of course, we wish you the best of health. Okay, tuloy-tuloy lang po natin ang pagsunod po dun sa mga medical advices po. And looking forward to seeing you to be a healthier individual. In the coming weeks, sana malapit, mabilis nang healthier na kayo. Okay, sir? Thank you very much, Sir Manuel. Thank you very much din, Doktora. Doksha, thank you very much sa lahat ng nai-impart. Thanks for the help that you'd been extending kay Sir Manuel and at sa mga generous inputs niyo po sa ating mga viewers. Okay, thank you very much. And Doktora, baka meron kayong mga final words para sa ating mga kasangbahay.
Okay, so thank you very much, Dr. Sarah. It was a pleasure to be here. I probably just have 3 key messages for our viewers po, no? So number 1, remember that hypertension is actually preventable and it is treatable. And it starts with knowing your blood pressure level. So don't be afraid, go to your healthcare provider and magpa-check up po kayo. So number 2, of course, is understand your symptoms and risks and consult the doctor para mas maintindihan niyo po what you have, kung ano yung sakit ninyo. And lastly, make the change that matters, no? So diet and exercise really helps lower your blood pressure. And if needed, and as prescribed by your doctor, you take your blood pressure medications regularly.
And thank you very much once again, Doktora. And you might want to invite them here at Makati Medical Center. So, the viewers can check out your cardiovascular laboratory here.
So, dear viewers, you can visit us, your friendly cardiologists in Makati Medical Center. And for any diagnostic tests, we have the basic ECG, 2D echo, ambulatory BP monitoring, and other tests. Do go to the Cardiovascular Disease Laboratory. That's the Heart Station, known as Heart Station, at 3rd floor, Tower 2 of Makati Med.
Thank you once again. And of course, mga kasambahay, huwag po kayong bibitiw dahil magbabalik po ang Doctors on TV.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 Home Kit. Thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Lifesaver dito sa UNTV, your public service channel.
Ang mga mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Naturally, in human norms and standards, those who are weak are despised. But in the Bible, those who are weak are given honor.
Best solution palagi is before you do anything, kneel down and pray. Ask for guidance kung ano yung pwede mong gawin sa buhay.
Alam niyo po, lahat under the sun na maiisip ng tao na gusto niyang malaman, mas makakakuha siya ng magandang perspective from the Bible.
God knows our infirmities. God knows that we are weak. We will sin whoever we are. But the question is not our sins. but our will to do His will. God will always have that compassion. For us to go to heaven, we have first to acknowledge the existence of God. That is the first and foremost thing that we have to do.
Ang isipin natin, God knows best. Sa Kanya ka magtiwala.
Minus God, then everything will be in vain. But with God, every problem will be solved.
Thank you once again, mga kasangbahay, and we are hoping to see you all again next week for another episode. And of course, I miss you and I love you very much, Tatay and Nanay. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-423133 or 028-824-5217 or 028-813-0320. Organic Acai. Support your health with 100% organic superfood supplement. Organic Acai Premium Blend and Acai Freeze-Dried Capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.